back, dear students. Today we will be looking at another chapter from your English textbook, that is from Unit 4, Chapter 4.2, Revolutionary Steps in Surgery. The images used in this video are taken from different internet websites. We have seen in our society the progress and development in the field of medicine and science over the past century. In present times, we are equipped with modern tools and techniques to combat different types of diseases, and also we found cures for various diseases. The increasing knowledge concerning human health and mechanisms of disease has been so rapid during the second half of the 20th century. Medical technology encompasses a wide range of medical devices. It includes medical and surgical procedures, drugs, equipment, and facilities, as well as the organization such as hospitals, healthcare centers, and supportive systems with which care is provided. Undergoing a surgery before anesthesia or antiseptics were introduced was very horrifying for patients. Cutting the body of the patient in order to remove the sick or damaged part brought infection or even death and a lot of pain. To operate, the doctors wore black coats. The coats provided protection for the surgeons from getting a patient's bodily fluid on their clothes. But no precautions were taken for the sake of the patients. A patient would be strapped or held down on the operating table by strong men, and throughout the surgery the doctors could hear the screams and thrashing of the patients. However, with the introduction of anesthesia in the 1800s, patients no longer had to fear the pain of an operation. By the 20th century, prevention of bacteria from entering the wound or sterile environment gained popularity. Through methods such as boiling, using autoclaves, and chemical antiseptics, sterile operating environments could be achieved. Well, students, now let us begin with the chapter. Surgery dates back to as early as 600 BC. Sushruta Samhita is one of the oldest works in the world dealing with surgery. It indicates that Sushruta was probably the first surgeon to perform surgical operations, that is, plastic surgery. Later, some ancient surgeons performed tooth extraction and bloodletting. In this paragraph, we understand that surgery is not a new concept that emerged in the last century, but it was introduced to us a long time back. Sushruta Samhita is one of the oldest books that deals with surgery, and we also learn that he was probably the first surgeon who performed surgical operation, that is plastic surgery. After which we come to know other surgeons who performed tooth extraction, that is removing the damaged tooth, and bloodletting, that is draining out blood. It was used as a preventive measure from falling sick. Sushruta was a physician in ancient India and was also known as the father of plastic surgery for inventing and developing surgical procedures. His works on the subject, the Sushruta Samhita, is considered as the oldest text in the world on plastic surgery and is highly regarded as one of the great trilogy of Ayurvedic medicine. The other two being the Charaka Samhita, which preceded it, and the Ashtanga Hridaya, which followed it. The great trilogy of Ayurvedic medicine describes surgical procedures, diagnostic techniques, and treatment for various illnesses and injuries. The work of Sushruta standardized and established earlier knowledge through careful description of how a physician should practice the art as well as specific procedures including performing plastic surgery, reconstructions and the removal of cataracts. Major surgery could not develop for centuries because of lack of knowledge and technology. The doctors had to cut open the part of the body that was not healthy, remove it, or set right that part. General anesthetics like ether or chloroform developed only from mid-19th century, making painless surgical operations possible and successful. Anesthetics is basically a substance or a gas that makes one feel no pain. In this paragraph, we understand that surgery could not be developed for many centuries, as the doctors would have to cut open the part of that body and which was not healthy and remove it and set right that part, and that patient would go through a lot of pain while doing so, as the patient would be awake when the operation would take place. Only after the introduction of anesthesia like ether and chloroform, that time surgical operations became more possible and people did not fear surgical operations after that. Modern techniques are used nowadays for anesthesia. General anesthesia benumbs the whole body and it is used for surgery of any region of the body. For local anesthesia, local anesthetics are injected into surgical spot or an area near the nerves. Over the years now, revolutionary steps have been taken in different types of complicated surgery, and these have made such operations successful. With the introduction of anesthesia, we realize surgical operations became much more easier for the doctors who are performing it on the patients, as well as for the patients who would not have to now go through a lot of pain. Let us start with cardiac surgery. Today, if you need to have a heart surgery, you can choose from many fine doctors. However, before 1893, this type of surgery was unknown. Doctors did not have modern medical tools and procedures essential for heart surgery. In those days, heart patients were treated with sedatives and they usually did not survive. Then in 1893, Daniel Hale Williams, a young African American surgeon, attempted a new medical technique in order to save a patient's life. In this paragraph, students, we understand that heart surgery was not introduced to us before the year 1893. Cardiac means relating to the heart. As there were no modern tools and procedures introduced, it was very difficult to perform the heart surgery. So essential, that means here necessary tools were not available, and that time heart patients were treated with sedatives, a substance that makes someone sleepy, which was not actually a solution for curing a heart problem. A patient, James Cornish, was suffering from a serious knife wound. The knife had cut an artery less than an inch from his heart and punctured the pericardium, that is, the sac around the heart. Dr. Williams, with 6 staff doctors, performed a complicated and daring surgery. Dr. Williams became the first surgeon to save his patient by successfully repairing the human heart. Now, many more advanced techniques are used in this specialty to deal with heart surgery, which can help to repair heart defects, heart valves, or even replace them, is also performed successfully. With proper measures, patients can recover from cardiac surgery faster than they did before. Heart valves are basically devices for allowing flow of blood in one direction only. Thus, after Dr. Williams performed this heart surgery on the patient James Cornish, it paved the way for heart surgery in the modern world. And hence after that, many more heart surgeries have been taken place due to Dr. Williams' daring and complicated surgery. Neurosurgery is another recent specialty to have received recognition since the early 1900s. It is concerned with the treatment of disorders of the nervous system. Neurosurgeons operate on the brain, the spine, or nerves. They can treat patients of all ages, from the newborn to the elderly who have suffered a stroke. Harvey Cushing is considered to be the father of modern neurological surgery. In the early part of the 20th century, he developed basic techniques and instruments for operating on the brain as a distinct surgical specialty. Cushing dramatically reduced the mortality rate for neurosurgery from 90% to less than 10%. By the time of his retirement in 1937, he had successfully removed more than 2,000 tumors. Neurosurgery is a surgical specialization that treats diseases and disorders of the brain and spinal cord. The concept of neurosurgery came to be known in the early 1900s. It is concerned to treat the health defects of the nervous system. As you know, neurosurgeons operate from all ages, that is from the newborn to the elderly. Harvey Cushing is known as the father of modern neurological surgery. In the early part of the 20th century, he was the man who developed easy techniques as well as instruments for operating on the brain. He also is known for reducing the mortality rate. Mortality rate is the death rate, especially on a large scale, for neurosurgery from 90% to less than 10% because of his techniques. By the time of his retirement in the year 1937, he had successfully removed more than 2,000 tumors. Tumor is an abnormal extra growth that takes place in your brain or around your nerves. The main reason that the mortality rates had been so high before was blood loss. Among Cushing's significant achievements are the methods he developed to stem this blood loss by inventing a clip called silver clip or Cushing clip. Thus, neurosurgery is one of the most cutting edges in the world of surgery and medicine. So here Harvey is given credit for inventing a silver clip, also known as Cushing clip, to control the blood loss that used to take place during neurosurgery. Stem is the word used for control, and it is in the field of surgery known as the latest develop in the world of surgery and medicine, that is neurosurgery. What is robotic surgery? Robotic surgery is a type of minimally invasive surgery. Minimally invasive means that instead of operating on patients through large incisions, use is made of miniaturized surgical instruments that fit through a series of quarter-inch incisions. Robotic surgery basically means a surgery that is carried by minimum surgical instruments. Well, this is a new type of surgery that came into existence in the last era. Incisions. Incisions means surgical cuts made in skin or flesh. Miniaturized means made in very small size. When performing surgery with the Da Vinci, the world's most advanced surgical robot, these miniaturized instruments are mounted on three separate robotic arms, allowing the surgeon maximum range of motion and precision. The Da Vinci's fourth arm contains a magnified high-definition 3D camera that guides the surgeon during the procedure. The surgeon controls these instruments and the camera from a console located in the operating room. Placing his fingers into the master controls, he is able to operate all the four arms of the Da Vinci. By looking through a stereoscopic high-definition monitor, the robot literally places the surgeon inside the patient. Well, as you can see in the images given on your screen, the robot contains three arms or four arms for that matter. Mounted here means it is set up with three separate robotic arms, allowing the surgeon maximum range of motion and precision. Precision here means he can move those arms in a very accurate way. The Da Vinci's fourth arm, as you can see in the second image, contains a magnified high-definition 3D camera. Magnified meaning it gives an enlarged view of the part of the body the operation is taking place on, that guides the surgeon during the procedure. The surgeon controls these instruments and the camera from a console. Now, a console is a combination of display input devices and control mechanisms used for controlling a robot. As you can see, the surgeon is sitting on a chair and using that console. Then he places his fingers into the master control and he is able to operate all the four arms of the Da Vinci by looking through a stereoscopic high-definition monitor. The robot literally places the surgeon inside the patient. This gives him a better, more detailed 3D view of the operating site than the surgeon's eye can provide. Every movement he makes with the master control is replicated accurately by the robot. When necessary, the surgeon can even change the scale of the robot's movement. If he selects a 3:1 scale, The tip of the robot will move just 1 inch for every 3 inches that the surgeon hand moves. Utilizing this advanced technology, our surgeons are able to perform a growing number of complex surgical procedures. Since now these procedures can be performed through very small incisions, our patients experience a number of benefits compared to the open surgery of the past. Here, replicated means making an exact copy as the surgeon moves his hand in the console. The robot copies the same way. Students, now let's do a quick activity to see if you can answer these questions. The first one is the first surgeon to perform operations. Yes, we know the answer. The first surgeon was Sushruta. The second one, anesthetics that were used from mid-19th century. Again, you all know that ether and chloroform were the anesthetics that were used from mid-19th century. Then the first successful cardiac surgeon, and we all know he paved the way for heart surgery, that is Daniel Hale Williams. What is a sac around the heart called? Yes, it is called the pericardium. Who is the father of modern neurosurgery? We all know that again it is none other than Harvey Cushing. What is the world's most advanced surgical robot? We all know that answer, that is the Da Vinci. It is the world's most advanced surgical robot. Now students, let's move on to question and answers and see if you can answer these. The first question is, why did the doctors begin to use anesthesia? Doctors could not cut open the part of the body that was not healthy to remove or set right the part, for this would involve a lot of pain to the patient. Hence, doctors began to use general anesthesia, which benumbs the whole body or part of the body. After this, the surgery could be done without pain to the patient. Then what had the patient James Cornish suffered from? James Cornish suffered from a very serious knife wound. The knife had cut an artery less than an inch from his heart and punctured the pericardium, which is the sac around the heart. The next question is, what kind of cardiac surgery is done nowadays? It's very simple again. Nowadays, more advanced techniques are used to deal with heart complications. Open heart surgery, which helps to repair heart defects and heart valves and even replace them, is also performed successfully. The last question is, what are the advantages of robotic surgery? The answer is very simple. Using this advanced technology, our surgeons are able to perform a growing number of complex surgical procedures. Since these procedures can now be performed through very small incisions or cuts, our patients experience a number of benefits compared to the open surgery of the past. Very well, students. I hope you understood this video. Thank you, dear students, and hope you enjoyed this video.